Hello, Dr. Willis. This is Joseph Izabor, a student of UMass Global. Today, I'm doing the interactive video on the psychotherapy on one of my patients. This patient was seen about 3 weeks ago, and she's here for a follow-up and was referred to the clinic by her PCP for therapy. She is a 64-year-old female from Accra, Ghana, in West Africa, who has given me consent for this recording of this video and to be submitted to the UMass Global for educational purpose. Chief complaint. She complained of social anxiety disorder, and she states she needs psychotherapy to help her cope with social anxiety disorder. History of present illness. Like I said, 64-year-old female from Accra, Ghana, in West Africa. But she presently lives in the United States with her daughter and two granddaughters. Patient states her anxiety, her social anxiety disorder started about 4 years ago when she fell at the park. Since then, she get depressed and fearful in a large gathering and whenever she's at the park. That's where her fear comes in. She always has the feeling that she may be judged by others. Patient reports sweating, trembling, rapid heart rate, mostly nauseous, and she feels tense and avoid eye contact. She reports that her appetite is normal. Past mental health history. She reported history of depression while she was living in Accra, Ghana, in West Africa. She was treated with the local African medicine for her depression. Psychotherapy of previous psychotrip, none. Current substance abuse history. She denies any drug intake, none. Her family history. She's married with 3 children. Her husband lives in Accra, Ghana. She lives here in the United States with a daughter and two grandchildren. She is a college graduate with a bachelor degree in accounting, but she is currently retired. Social history. She reported history so poor because of the fear of the association. Medical history. She has hypertension and currently on medicine for it. She's on 10 milligrams of amlodipine tablet, PO daily. She denied any other past medical history. We need to identify that cultural differences may play a major role in patient perception and behavior. Cultural differences are the core beliefs in behavioral, language, practice, expressions. Consider unique society of region. For example, Ghanaian society, the Ghanaian people may review the person as being weird or abnormal when one tends not to socialize or isolate oneself from the people. For this patient, I will be using 3 different types of psychotherapy techniques or modality to manage a social anxiety disorder. This modality can be applicable to all cultures. This psychotherapy will provide an atmosphere that will allow the patient to express feelings, thought process, and how it will in turn create a positive behavior. The session will focus mainly on patient strengths rather than our weaknesses. The three psychotherapy that I will be implementing as follows. The first one is the CBT, called it systemic desensitization. This was developed by a South African psychiatrist called Joseph Walpole. It is used in a clinical psychology to help many people effectively to overcome phobias and other anxiety disorder. Shared the same element of both cognitive behavior therapy and applied behavioral analysis. The goal of the CBT and social anxiety disorder is to identify a rational belief and thought pattern and replaces them with more realistic view of thoughts, emotion, and behaviors that are all related together. This training involved realization of gradual exposure of anxiety in a provoking situation so that over time elicit the less fear. The second psychotherapy technique that I'll be implementing on this patient will be the mindfulness for social anxiety disorder. The practice of mindfulness medication involve planning to become aware of your emotions and thoughts without reacting to them. Mindful teachings, mindfulness teaches one to slow down, raising thoughts, letting go of negativity, and to calm both mind and body. It can be defined as mental states that involve being focused on the now. So one can acknowledge and accept feelings and sensations without judgment. Through mindfulness, we can discover the difficulty and unwanted thoughts and feelings and can be held in awareness and seen from another different perspective. It brings a sense of warmth, compassion, and to the suffering you are experiencing. Mindfulness can also help you learn how to present and appreciate simple pleasure of everyday life, connecting with oneself and experience of being alive. The third one that I'm going to be implementing, the third psychotherapy techniques will be the guided imagery for social anxiety disorder. These unique techniques involve use of visualization to help you enter a relaxed state, like by closing your eyes to imagine the sounds on side of a place that you find relaxing. Because of the way the time and the body are connected, the guided imagery can make you feel something just by imagining it. It's your imagination that will accept you into calmness and peaceful place. It helps with anxiety by allowing you to manage negative emotions. It can also be used to visualize positive outcomes in various social and performance situations. The guided imagery will give you a chance to experience the best possible outcome before entering a situation. I believe in using these three techniques in the following order: systemic desensitization, mindfulness, and guided imagery, as they are interrelated. The goal are to reduce the fear factor, to be mindful of her thoughts process, and guided imagery to help her relax in a calm and soothing environment. Expecting the patient to be less fearful of social gathering, to turn negative thoughts into positive thinking, which in turn will manifest in a positive behavior by being happy and function well in a society. However, it is pertinent to remember that the benefit of psychotherapy can only be achieved if the patient is willing to participate in this exercise. There are so many barriers to successful psychotherapy, including missing appointments, not doing homework, or forgetting to do the assigned work. This segment two will be my patient coming in, and I will go through the techniques with her. Gloria is here. Good morning, Gloria. How are you doing today?
Good morning. I'm fine, thank you.
Do you understand that you have given consent for the recording of this video to be given to the UMass Global for educational purpose?
Yes, I understand that I give a signed consent for this session to be recorded for educational purpose.
Thank you for doing that. Based on your last visit 3 weeks ago, I discussed with you that we'll go through the psychotherapy techniques to help deal with your social anxiety disorder. We will be talking about the relaxation techniques, which you will be gradually exposed to. We will go into a role play with you and introduce you to some situations on how anxiety happens. And you will let me know how it makes you feel before we start the process. And let me know how you feel when you finish the process. The first one we're going to talk about is the systemic desensitization. I am going to be your proposed boss, and you will be here. You will be here for a job interview. So we're going to do a role play on that. So Gloria,
Yeah.
why do you think you are the best for this job, the position that you applied for?
I'm the best fit because I have years of experience and also my education.
Why must I hire you?
I'm a dedicated and motivated learner with excellent critical thinking, um, problem solving, and I have time management skills.
How can you best fit into our organization?
I am here to bring in new experience to the position.
Now, Gloria, when you heard me say we're going to do a role play in such that I'll be your proposed boss and you are here for an interview, what went through your mind and what were you thinking initially?
Oh, my mind started to race. I started sweating, and the fear of an interview as I might not answer the questions correctly.
Excellent. That is the whole idea of having the fear factor and getting used to things like that. This in turn will help you to decrease your anxiety. As part of your own work, I will advise you to find things that gets you anxious and let your daughter or your granddaughter perform role play on this situation. So we could talk about the role play in our next appointment to see how you're doing. Will you do that, Gloria?
Yes, I will.
So we're gonna meet in 2 weeks.
Okay.
Thank you for coming in.
Thank you.
All right, you're welcome, Gloria. Good afternoon, Gloria. How are you doing today?
Good afternoon. I'm fine. Thank you.
Last session, which was 2 weeks ago, we did a role play on how to help with your anxiety using a psychotherapy technique called the systemic desensitization. Were you able to do some practice at home?
Yes.
You did some practice with some family members. How are you feeling now with things happening?
To be honest, I am less anxious now.
Great. Today we're going into a little bit of another technique called mindfulness. This is where you let your thoughts, your emotion comes without reaction in any way, but just let it flow. We're going to do a little exercise. I will let have you sit down on a chair and make yourself very comfortable and put your arm in an armrest. If you need to take off your shoes, that will be fine as well. Now, I will want you to take a deep breath and focus on your breathing in and out and feel your belly rise and fall as the air enters your nose and inside. While you're doing that, I want you to notice your thoughts and remain calm. Do not be hurt. Do not be hard on yourself. If you need a break, yes, please, you can take a break, then come back and return to breathing and focusing again. We're going to do this for 2 to 3 minutes. Just remain calm and your thought will flow in and out. Let me know when you're coming back and done so we can talk about the impact of the exercise you just did on your thoughts and emotion. Are you back to us now? Do you want to tell me about your feelings? What did you experience, Glory?
Right now I feel more relaxed. I feel negative thoughts have gone away and remaining the positive thoughts.
Oh, great. More positive thoughts staying in the whole, it's the whole idea of the exercise. I will also give you some homework at the end of this session so you can go home and practice more mindfulness. Do relaxation and take a deep breath and allow positive thoughts to prevail while negative thoughts wander out.
Okay, thank you so much.
Thank you for being with me today, and I will see you in 2 weeks. Gloria,
Alright, thank you.
thank you. Oh, Gloria, good morning. How are you doing today, Gloria? Nice to see you again.
Good morning, I'm fine, thank you. Nice to see you too.
2 weeks ago, the last session we had, we did a role play on how to help with your anxiety using the psychotherapy techniques, the modality of the mindfulness, and we did some exercise. Were you able to do some practice at home?
Yes, I did.
How do you feel about the anxiety, your anxiety? If you have to go out to a social gathering, if you have to go to the store or the park, since you have done a few of the techniques now, how do you feel?
Right now I feel very much better and feeling more positive. I have started going to the store and spending more time in the store and at the park, especially more than before. but I still experience just a little bit of anxiety. But it's nothing compared to what I've been having in the past, and I see a lot of improvement, to be honest.
Were you able to practice some mindfulness at home too?
Yeah, I did a couple of times, and it relaxes me each time I did.
Very good, Gloria. Today we're going to practice the use of guided imagery for your social anxiety disorder. That's the thought techniques we're going to implement to help you alleviate your anxiety. I will guide you through another form of, it's a form of relaxation and imaging. I want you to close your eyes and imagine a very fantastic place that you have been before. Imagining you are by the ocean, the skies are blue, weather is cool, and nice smell of roses. I would love you to stay in this trance as much longer as you can. When you're done, please slowly open your eyes to calm down. It helps to replace an outcome before the situation. So, how do you feel after completing this relaxation and imaging techniques?
Um, I feel better and less anxious. Anytime I do exercise like this, it makes me feel better.
Great. So you mean you can go out and do better than before.
Yes, I can.
The homework for today is for you to go do some more imaging and having fun before you go to the park or store. Thank you, Gloria. The homework for you is for you to, yeah, do some of more of the relaxation and imagery, and I will discuss more of that with you in 2 weeks.
Okay, thank you so much. And I'll see you again in 2 weeks.
Thank you, Gloria. So the summary of this assignment is this assignment was very therapeutic for both patient and the therapist. The therapist was able to know the patient better on her fears and provided the psychotherapy session to help in alleviating patient's fear. The therapy section went well as planned. Patient made it work because she wants to have her life back and become normal again. The three modalities ended well, and the goal here is to eradicate rational beliefs, thought patterns, and replacing them with more realistic views. When you think positively, you'll be happier and have less stress. Our thinking manifests in our behavior. Thank you so much for watching my video. Thank you.